A paramedic is often responsible for administering medications in emergency situations. These icons represent the individual steps for administering medicine. Pay special attention to them. Whether the medication is supplied by the EMS agency or comes from the patient, before administering the medicine, it is important to consider the answers to these key questions. What is the type of medication being administered? Is the medication expired? Does the patient have an allergy to this medication? What is the safe and effective dose? What is the correct administration route? What are the indications and contraindications? What are the expected results? And what are the adverse side effects? Take body substance isolation precautions. Prior to administering the medication, take and verbalize body substance isolation precautions and put on protective gloves. Verify the rights of medication administration. Before administering medication, first you will need to verify the 6 rights of medication administration. Make sure you have the right patient. Make sure the patient does not have any contraindications to the medication. The right medication. Carefully read the labels to ensure the medication you are about to administer is correct. The right dosage. To ensure that the right dose is given, the administrator must double-check any calculations. Right time. The administrator should check the medication order to ensure that the medication is given at the right time. The right route. Make sure that the route of administration of the particular medication is appropriate. The right documentation. Always document medication administration on an appropriate form. This completes the 6 rights of medication administration. Choose the administration route. It is important to choose the way medication will be administered to the patient. The route chosen will depend on the type of medication, how quickly the medication will take effect, and the desired location and mechanism of action. The primary routes of medication administration include oral, sublingual, inhalation, nasal, transdermal, subcutaneous injection, intramuscular injection, intravenous injection, and intraosseous injection. When administering oral medication, make sure the patient is conscious, has an intact gag reflex, and is in a Fowler's or semi-Fowler's position. The medication can be placed in a patient's hand or directly in their mouth. The medication is absorbed through the gastrointestinal tract. A good example of commonly administered oral medication is aspirin. When administering sublingual medication, place the medication under the tongue. The medication is absorbed through the mucous membranes of the mouth. A good example of sublingual medication is nitroglycerin. When administering inhaled medication, place the inhaler in the patient's mouth and administer the medicine accordingly, and ask the patient to inhale. Good examples of commonly administered inhaled medications are asthma medications such as albuterol and Xopenex. When using a subcutaneous delivery method, the medicine is injected into subcutaneous tissue under the skin. Common subcutaneous injection sites include lateral aspect of the upper arm, the abdomen from the costal margins to the iliac crests, the anterior thighs, and the upper area of the buttock just behind the hip bone. A good example of a commonly administered subcutaneous medication is insulin, which requires a slow and steady release. When using an intramuscular delivery method, the medicine is injected directly into the muscle tissue in a chosen location within the body. Possible intramuscular injection sites include the deltoid muscle of the upper arm, the vastus lateralis, and rectus femoris in the thigh region, and the dorsogluteal or ventrogluteal regions. A good example of commonly administered intramuscular medication is haloperidol. The intravenous route is a common and fast delivery method for medications. The intravenous medication can be injected into an infusion port on the IV tubing or directly into a vein using a syringe. A good example of commonly administered intravenous medication is sodium bicarbonate. When administering an intraosseous delivery method, the medication is injected directly into the bone marrow. Intraosseous access is an alternative method of gaining vascular access, and it is utilized when IV access is unsuccessful or delayed in a critically ill or injured patient and in cardiac arrest. Possible intraosseous injection sites include distal femur, proximal tibia, distal medial tibia, proximal humerus, and sternum. Most medications that are administered through an IV can also be administered through an IO. A good example of commonly administered intraosseous medication is sodium bicarbonate. Prepare the patient. Before administering medicine, place the patient in an appropriate position using aseptic technique. Clean the area with an antiseptic using concentric circles. Administer the medicine. When using the subcutaneous delivery, draw the medication into a syringe utilizing a 25 to 28 gauge and a 1/2 to 5/8 inch needle size for adults and a 25 to 28 gauge and 1/2 to 3/8 of an inch for children. Give the injection at a 45 to 90 degree angle into a pinched and raised skin fold. When using intramuscular delivery, you can use a needled syringe or an auto-injector. When using a needled syringe, first purge the air from the syringe by angling the needle upright. Next, push the plunger until all the air is released and a small amount of medication exits the needle. Pinch the skin, insert the needle at a 90-degree angle through the skin and into the muscle. Pull on the plunger and aspirate to ensure that the needle was placed into the muscle and not mistakenly placed in a blood vessel. If blood is aspirated, the syringe should be discarded and a fresh drug prepared. If no blood appears, proceed to inject the medication. Wait for a few seconds before withdrawing the needle. If you are using an auto-injector, first you will need to remove the safety cap. Place the end of the injector perpendicular to the skin. Press firmly to deliver the dosage. Wait for a few seconds before withdrawing the needle. Monitor the patient. After medication administration, carefully monitor the patient for side effects, adverse effects, serious allergic reactions, and signs of medication overdose. Serious allergic reactions and signs of overdose require immediate medical attention. Record the procedure on the appropriate form. Document the procedure and observations in the pre-hospital care form.